on a scale of 1 to 10, 10 being most likely, what you believe the likelihood of passage for a comprehensive health care bill by the end of the year will be, 10 being most likely, and what you believe to be the most daunting or concerning, your choice, issue left on the negotiating table that we've been hearing about, whether that be the public plan versus co-op versus private plans in an insurance exchange, whether that be the affordability issues with subsidies and the individual mandate issues that we've been hearing about.
Why don't we let the former members go first on this one, because they're the ones who actually have to vote on this.
Absolutely.
I'll start with that. I would say an 8 that something will pass, and clearly the most difficult thing is how you pay for it. Everything else pales by comparison.
Very good.
I would say 5, because I think the hardest thing is the incentives to control cost, and they're not nearly aggressive enough. People know it. People who are worried about the cost know it. They can deal with the cost if they can deal with long-term cost control, and that's all about changing incentives.
Thank you.
Well, I think something's going to pass, whether it's really comprehensive as you might define comprehensive, but something's going to pass that then someone can claim victory that we've done it comprehensively, but it may not really be comprehensive. And I think the number one thing is Representative Frost is absolutely financing.
Very good.
The president will sign a bill. Rahm Emanuel was in the White House during the Clinton years when a bill wasn't signed. They saw the political price they paid for it. At some point, a bill will be signed. Like Senator Barrasso, I have no earthly idea whether it truly will be comprehensive or truly will control costs. And costs are important. I'd probably worry more about the issue of the mandate, the individual employer mandate being discussed. My opinion, mandates have no place in a free society. We've lived with an employer mandate since 1988 under the EMTALA laws, where anybody that shows up in the emergency room is required to get care within 30 minutes, at least stabilization, or in the case of an OB-GYN, delivery of the baby. It has led to a mindset that the emergency room actually is the place you go to get care. The emergency room has always been overused and abused in any system, but with the EMTALA laws, which were passed for the best of reasons, that certainly prior to my time, but to prevent hospitals from dumping a patient from one location to another because they didn't have insurance. But coupled in that was a provider mandate where the doctor is now under an obligation to provide that care within a 30-minute time interval or face a rather large civil money penalty. Texas was sort of the test case for that down in Victoria in the late 1980s, and it's certainly something I lived with for the rest of my professional career.